COVID-19 as a trigger for IBS? There's some research that says this might be the case. Additionally, some changes in our gut microbiome may be associated with risk of COVID-19 and severity, and that's the research I'm going to be talking about today. I'm Taylor. I'm one of the nutrition consultants, registered dietitians, and certified diabetes educators with the Diet versus Disease team. We are a team of 11 gut health experts, and I am so excited today to talk a little bit about gut microbiome, COVID-19, and what this new research is saying. Okay, so this first study, what it looked at was individuals that had a COVID infection, also when they were receiving COVID treatment, how this impacted our digestive tract, as well as some of the psychological or that gut-brain axis impacts on our digestion or IBS. What they found were due to impairment of the gut-brain axis, due to a potential COVID infection, or any post-infection, I should say, post-infectious IBS has been around before COVID-19 as well. These shifts include dysbiosis, so a shift in bacteria in our digestive tract, increased intestinal permeability, and so these are our tight junctions in our digestive tract. It will impact our epithelial lining and our gut mucosal lining, which can help with a lot of the health of our microbiome and bacteria, and different regulation in terms of digestion and motility in our digestive tract too. Secondly, different types of treatment with COVID-19 can also impact our gut microbiome. This is not an area of specialty for me. I'm not an endocrinologist and I don't treat it. However, the research did look at some of the biologic agents or some of the antivirals that can be used can also impact our gut microbiome, leading to impairment of that gut-brain axis in the long run, leading to post-infectious IBS. And then third off is that psychological distress when we have symptoms, when we're unwell. And this is a bit of a chicken and the egg, because with our gut-brain axis, this can also impact our stress, and then our stress can activate different parts of our nervous system as well. And so activation of the HPA axis can then lead to some of this impairment of the gut-brain axis as well, resulting in post-infectious IBS. It's phenomenal research to look at, and like I said, post-infectious IBS is not new. It's something we have a lot of information about previously, but this is the first time we've really looked at it at a scale related to a virus or infection that's more relevant to us right now as well. So the second study I wanted to quickly talk about looked at patients that were admitted to hospital with different types of symptoms. 43% had respiratory symptoms only, 33% had both respiratory and digestive symptoms, and among the patients with digestive symptoms, 67% of them had diarrhea, 20% experienced diarrhea as their first symptom before any other symptoms as well. This diarrhea lasted anywhere from 5 days to long term, really depending on the person. The study found that those with gastrointestinal symptoms were much more likely to have COVID directly in their stool samples, with about 73% of patients testing positively compared to 14% with respiratory symptoms only. Again, this research can help to show how this can impact our microbiome and shift our microbiome as well, and what symptoms can lead to that post-infectious IBS. This is just another example how so many factors impact our gut health, our gut microbiome. In this instant, we're looking at some of the negative factors, so our microbiome might lead to increased infection or severity, or an infection might lead to shifts in our microbiome. However, there are so many things we can do to have a positive impact on our microbiome too, and that's exactly the area that we specialize as digestive health dietitians. That is what we care about, that is what we do. If you're looking for this personalized support, what you can help with managing is what we call our gut microbiome resilience. So this is our digestive health ability to bounce back. We want to maintain a really healthy bacterial colony, and our microbiome, I say bacterial, but our microbiome is actually made up of healthy viruses, healthy bacteria, archaea, fungi. There's a lot of components that build up this microbiome, all of which play a really important role. We want to help with managing our mucosal lining, which helps with that epithelial barrier function as well. And those are some of the key pieces that we definitely recommend people focus on to help with that gut health resilience. Okay, so now for the fun part. What can we actually do about this? There's a few different things I'm going to talk about, and this is probably the important meat and bones in terms of we want to incorporate fiber. People always hear this, eat more fiber, but it is honestly one that's so important. Soluble fiber, insoluble fiber, prebiotic fibers, all of which play different roles in our digestive health, and all are really important. Fermented foods and probiotic containing foods can also be helpful. Those fall into slightly different categories but have really important roles. If you're low FODMAP or low histamine, it's really important to work with your health provider in terms of how do you incorporate this in a way that's sustainable for you. And if you're not sure what low FODMAP or low histamine is, let me know, comment below, and we'll get an answer to you or direct you to some of our other videos that explain that. So those are going to be some really important ones. In addition, phytochemicals and phytonutrients. So these are those antioxidants that can help with neutralizing free radicals. So ultimately, they are helping to reduce some of those compounds that can cause damage to our cells and reducing the stress on our body. And eat the rainbow you often hear, and there's a reason for that. All of the different colors do often contain different antioxidants and phytochemicals that can play such an important role. The fourth one is going to be incorporating healthy fats. These are those PUFAs, MUFAs, and omegas, including EPA, DHA, and ALA. These are found in things like fatty fish. Again, if you're low histamine, that one's not for you. Avocado, if you're low FODMAP, that one's not for you. Olive oil is a beautiful one, and that fits into a lot of different types of food intolerances. Typically, one thing to be a little bit cautious with is spreading our fat intake out throughout the day. We don't just want to get it all at once. That can sometimes be hard on our digestion as well. And so those are going to be some of the factors to really focus on and incorporate, and see how you can incorporate it, or what things are you already doing well. And then lastly, I would say how that fits into everybody's diet and into everyone's day and week is going to look a little bit different depending on if they have intolerances or other things that they're managing. So if you're wanting a microbiome guide and you're watching this on Instagram or Facebook, comment microbiome guide below and we'll send you our brief guide. If you're watching this on YouTube, I can't send it directly to you, but feel free to send me a message. Instagram is @guthealthrecipes. Facebook, it's going to be Joe Leach, or you can also find us at FODMAP Reboot. Both areas are going to, you can message us. Find me, Taylor Hanna Dietitian, as well, and we'll be happy to support you in that. Questions you ask as well, we'll be happy to answer. And if you're looking for more individualized support in integrating that, you feel this resonates with you, you want to work on your gut microbiome resilience. Again, our gut microbiome is so important for immunity and digestion, so many things. Let us know, and that is something that we can help you out with or provide you with a little bit more information about as well. Cheers!